Allergies are something Austinites know about all too well, and if you don't, just keep living here. But what they may not know is that medications commonly used to treat the symptoms are now being linked to decreased fertility in men. Dr. Parviz Kavusi, a reproductive urologist at St. David's South Medical Center, is here to tell us more about this new information. So what prompted this study?
So I think what we're looking for is to see why we're seeing fertility worsen in men over time. As a population in the United States, we're seeing men get less fertile as time goes on. And the question is there an environmental factor, medications, technologies, industrialization, what have you, that's affecting our fertility and making us less fertile? So we're always investigating things, and I think common medications that are used is an important place to look. So this recent study looked at antihistamines, and obviously being in one of the allergy capitals of the planet, that's important for us to be aware of when we're taking care of our fertility patients. This was a review article, so they looked at a lot of articles that had previously been published, but what an article says, it's just important to look and see the methodology on how it's performed. So this was a review, and all the studies that they included was really just in animal studies, animal research, looking at mice, at rats, guinea pigs, lizards, and they found that it could affect testicular function. A lot of that had to do with the hormones inside the testicles, and some data showing effect on fertility. The issue is that animal research doesn't always translate into what we see in human research. So this is an early study to give us an idea of what may be going on, and is this something we need to look at closer with more human research.
So do you feel it is credible?
I would tell you that at this point, I don't think that every guy trying to get his partner pregnant needs to stop their antihistamines if they have severe allergies. It's going to be kind of a balancing the risk and benefits. This data that we have now certainly is not, it's not robust enough to say that this is a for sure effect. And anecdotally, obviously, we practice medicine based on the best science that we have, but do I have a waiting room full of guys that are having trouble getting their partners pregnant that are all on antihistamines chronically? I don't. If there's a couple that's really struggling and they want every variable out of the equation and the male has severe allergic responses that require chronic antihistamines, it may not be a bad idea for him to see an allergist and consider other treatments potentially like allergy injections that don't have that antihistamine effect. But based on the present data, is it strong enough for me to tell all my patients, you need to get off antihistamines? Not at this point.
And so are there any things that men can do to try to increase their fertility?
Yes, that's a great question. What we know is that what's good for overall health is good for a man's fertility health. So low fat, low cholesterol diet, cardiovascular exercise, keeping a good muscle to fat ratio, no tobacco, minimal alcohol, no marijuana, staying out of hot tubs, staying out of warm baths, staying out of saunas, keeping laptops off the lap. There's some data now suggesting cell phones in the front pocket can potentially affect things to some extent. So those are the things that we really focus on in trying to optimize lifestyle factors to try to make the men more healthy and more fertile.
All right, very good tips there. Well, thank you so much, Doctor, for joining us today, and we'll be right back.